America's choice in home care.
Good morning, everyone. I have, let's see here, I have 11 a.m. So it is time to get started with our coffee chat. Good morning and welcome. My name is Mary Ellen Wilson. I am your Business Development Manager here at Visiting Angels. And for those of you who are new to our coffee chats, welcome. We do our coffee chats actually twice a month, and we here at Visiting Angels were so sad when the pandemic started for a multitude of reasons, not the least of which was the fact that it meant we could not come out and see all of you, our wonderful clients and clients to be, and our wonderful referral partners. So we started to do coffee chats where we bring you a topic of interest to senior adults or older adults in our general viewing area. And today I am super excited about our topic, which I'll get to in just a moment. So in case you didn't know this, Visiting Angels has offices in Gaithersburg, Silver Spring, Edgewater, Maryland, and Washington, D.C. Today, we are going to be talking about services that are available to residents in Montgomery County, as well as the surrounding areas. So without further ado, I would love to introduce my guest today, Julia Abate, who is with the Arc Montgomery County. And let's see, two things I need to do is first, I need to record because I always forget to put that button on. There we go. And secondly, welcome Jules. Hello, Jules. And I think that you are still muted, my friend. I had a feeling. And this is what is so much fun with Zoom calls. You never know what.
There you go. How's that?
There it is. You never know when you're going to be muted or unmuted. It's like a game. Jules, welcome. So today we're going to be talking about respite services in Montgomery County. But before we even begin with the good stuff, Jules, I'd love for you to briefly introduce yourself. Tell us who you are, etc.
Okay. Well, thanks so much, Mary Ellen, for coordinating this coffee chat. So good morning, everyone. My name is Julia Abate. Most people know me as Jules. I am the respite administrator with the Arc Montgomery County.
Fabulous. There it is. So the Arc Montgomery County, tell us a little bit about that. What is that?
The Arc Montgomery County is a private nonprofit which provides a continuum of support of services to connect people of all ages with and without disabilities as they build an inclusive, fulfilling lives in the community. We offer inclusive childcare, youth programming, adult employment and community living, and of course, the coordination of respite for people with disabilities and senior citizens.
Okay, so for our listeners who may not know what respite is or what respite means, can you tell us exactly what that is? What is respite?
Sure. The meaning of respite is to take a break from caregiving. It's an opportunity for the primary caregiver to have a short break from their duties of care and address their own needs.
Okay. All right. So tell me more about that. Who in Montgomery County can benefit from respite?
If you're an unpaid live-in primary caregiver residing in Montgomery County and caring for a frail senior, a child with challenging behavior, a child or an adult with an intellectual disability, or a child or adult with a functional disability. And when you think of a functional disability, that is someone that may be diagnosed with MS, lupus, or cancer, diabetes, and more.
Okay. All right. So if I'm to understand then, respite services, you can benefit from respite if you are a non-paid caregiver. So you're living in a home with someone that you are caring for that either has developmental disabilities or is a frail senior or has some of the other functional disabilities that you mentioned, cancer, MS, advanced diabetes, etc. Did I sum
Yeah.
that up?
Yes, that's a requirement of the program. The caregiver and the person with the disability must reside in the Montgomery County residence.
Okay. All right. So now that we know who can benefit from your services, tell me how many people are being served in the respite program? And also, can you provide us with some examples of caregivers in the ARC's respite program?
Sure. We have now over 615 families being supported through the coordination of respite through the ARC. Some examples of caregivers are a spouse caring for their spouse, a parent caring for their child or their adult child with an intellectual disability, a sibling caring for a sibling for MS, a grandparent caring for a child with a disability, or a partner caring for another partner with a heart condition.
Okay, very interesting. I guess whenever I think of respite services, I think of spouses. So I guess that the non-paid caregiver can take many different forms of exactly what you just suggested. All right, so I noted that there can be some different different reasons for a caregiver looking for respite. Can you give me one or two of those scenarios?
Why a family is looking for respite?
Yeah, so I actually have a cheat sheet, and something that we didn't mention is sometimes the family member just wants to go on vacation, right?
Right. So just so you know, families are eligible for 140 hours of respite in a fiscal year. So you can use your respite hours in many different venues, such as in-home respite that Visiting Angels could provide. It could be with a respite facility. The individual, we will connect and coordinate the caregiver with local respite facilities. It could be in a therapeutic program for senior or someone with a disability, and it can be in a therapeutic work program as well. And it could be an adult medical day or an adult social program. Right now with COVID-19, unfortunately, adult medical day and adult social programs and therapeutic programs are closed. So right now, currently, most families are receiving respite in the home or at a respite facility.
Okay, all right. So in the home, of course, is how Visiting Angels coordinates with the respite services that the ARC provides. So let's hear about how does a caregiver apply for respite? What's the process?
There are a few options. Our respite applications are on our website. And if you go to www.thearcmontgomerycounty.org, under what we do, there'll be 3 applications. An application will be there for children 17 and under. There'll be an application for adult 18 to 59, and then a senior application for anyone that's 60 or older.
Okay.
And you can also call our office at 301-984-5777, extension 1206, and we could mail an application.
Is that extension 1204 or 1206?
Well, actually right now during COVID-19, all the phone calls are being routed to my work cell phone. So either 1204 or 1206.
Okay. All right. So as you can see on the slide, I do have the website up here and I do have the phone number, but I put 1204. So there you go.
Yep. They will,
All right.
the phone calls will be forwarded to me directly.
Okay. Terrific.
Just to make sure everyone knows, the ARC's headquarters is closed to all visitors, and we are working remotely for the most part. Some of the team members will go in several times a week, but for the most part, we're working remotely, and we have been since March 20th.
Same with our office. And,
Yeah.
you know, it's amazing how we can get things done, even
Yes.
with the obstacles that are put in our way. That's for sure. Okay, so now we learn how to go through and the connection for applying. So what happens after the family applies?
Well, once we receive the application, we'll notify the family that we received it. If their family is missing some supporting documents or some questions on the application were not filled out, we'll notify them. But if we receive everything, usually we ask 30 days to process the application, and then I will call you and I will schedule a family orientation, which is typically done in person, but during COVID-19, we're not able to do that. So it's usually a phone call, or if some of our families are more tech savvy, I will be willing to do a Zoom call as well. We also invite any other family member to the orientation. Orientation is really important to ensure the family has really good knowledge of the program. And it is really critical that they help find a respite provider like Visiting Angels. And it's totally up to the family to decide who the respite provider is going to be.
Okay. So before we get to that, let me ask you this. What happens exactly during orientation?
Well, as a respite administrator, I have the pleasure of providing family orientation. The orientation gives me a better opportunity to understand the needs of the family. This begins with me just asking a couple questions. Basically, I want to know, what would the caregiver do if they had a break? What would they like to do? And caregiving is such a demanding job, and they always put their needs of their loved one before their own needs. So I'd just like to know, what did they do before they became a full-time caregiver? I also like to ask families, what brought them joy before they became a full-time caregiver? And I hear so many different answers. I used to sing in the church choir. I belonged to a book club. I used to love to travel. I love seeing my other children and grandchildren. But the answer always ends with, but I can't do that anymore. I need to care for my loved one. So caregivers are giving up a lot of their own lives. So respite is a great time to give them that much needed break from caregiving. Then I like to get a little acquainted with the family during orientation and review the guidelines of the program and how we coordinate the program. And then I help the family select a respite provider.
Okay. So, and just to be clear, Visiting Angels has partnered with Arc Montgomery to be a respite provider. And so we would provide our home care consultants, our CNAs, to a respite recipient. And we do that. We have quite a few clients under this program. So Jules, tell our audience what the cost is to the caregiver.
Well, Mary Ellen, Visiting Angels has been a consortium member with the Arc of Montgomery County for many years. And again, the Arc Montgomery County does not deliver respite. We work with consortium members like Visiting Angels who have the staff who are trained and have the skills and abilities to take care of seniors. We subsidize payment to visiting angels, so the caregiver will not have to pay any out-of-pocket expenses. We do have some consortium members that have a higher rate. For example, they may not take our respite rate, but it may cost the family a few dollars. Visiting Angels does accept the respite rate. So families who select Visiting Angels as their respite provider may get 140 hours of service and not cost anything. The payment from Visiting Angels, again, comes from a grant from the Department of Health and Human Services.
And I think that that's really something that has to be emphasized with this program for Montgomery County residents is it is zero cost to the family. And I think that that's very, very important.
Yeah, we're very fortunate right now, Mary Ellen, is that if you're a senior applying for caring for another senior, it's important that it's not income-based for seniors. The income for children has been lifted. So we've been very, very, very fortunate. It's been lifted because of COVID-19. So this is a great program for anyone who does not have any kind of support.
Great. And what else? Any other last little bits of information that you want to share about the program?
Well, families have to apply and they have to reapply every year. That's part of the grant program. We follow a fiscal year, which is July through June 30th. In-home respite has some limitations. For example, we cannot approve more than 40 hours in a month and no more than 10 hours per day. The respite program does not allow for overnight care. Of course, if a family needs overnight care, they could work with Visiting Angels to provide that.
Mm-hmm. Absolutely.
Yeah.
Anything else?
Just want to make sure that we know that the families decide on who their respite provider is.
Yes. So how does that work? Do you give them a list of providers?
No, we don't provide a list because we have so many consortium members. And one of the things that we have to track is to ensure that all the consortium members, like Visiting Angels, keep their insurance and licensings current. So we have to monitor that. And if we put out a list, it gets spread all over the place, and family might say, I want to use that agency, and that agency may have gone out of business or expired. So we offer usually 3 providers, and it also can be based on other factors. We deal with a lot of home healthcare agencies that have specific languages. So we work with an agency that has Russian, Slovak, and Farsi language speakings. We had a family that needed several seniors that spoke Italian, and Visiting Angels was able to provide that with us. Spanish, we're always looking for agencies that can provide Spanish caregivers. So that is a big, big way families make their decision on what agency to pick.
Absolutely. Terrific. All right. So for our listeners, if you have questions, I forgot to mention this, go ahead and put them in the Q&A box. We are going to go through questions at the end. And if you are watching us on Facebook, hello, go ahead and put your question in the comment section. And we have Tiffany behind the scenes who will go ahead and let us know what questions pop up on that. Okay, so I love this program, Visiting Angels. Oftentimes we are referring callers that call us to the Arc of Montgomery for the respite services. So it is a very wonderful program that for Montgomery County residents can really be a lifesaver. So what about for those who are in other areas? Well, There are similar programs. When I send out the recording to this video, I will send you links that you can click on. But if you are in Washington, D.C., the D.C. Department of Aging and Community Living does have a respite program. Prince George's County, PG County Adult Services Respite Program is available to you. Like I said, I will send those links to you. One really great program that it doesn't matter where you live, as long as you're in the United States, is the Vet Assist program. And Visiting Angels works with the veterans. We've teamed up with the Veterans Home Care Administration to provide respite hours for, and it's really home care hours for vets and their spouses and surviving spouses. So if you have a parent or if you yourself are a vet and you qualify for these services, you can get benefits. You can get home care with no out-of-pocket cost to you. So another great one. If you would like more information on that, I did put my phone number up there, and you'll see that again towards the end. Some other community resources, which I think are just wonderful. And again, when I send out the recording link, you will have all of these links. But Senior Call Check program, that is done by the state of Maryland, where you can sign up to have your loved one or you yourself receive a phone call, a check-in phone call every morning to make sure all is well. And if they cannot get a hold of you, then they have someone's contact information on file who they then call to say, hey, your mom didn't pick up this morning, or whatever the case may be. Senior shopping hours. This is a huge file. When you get this link, it shows, due to COVID-19, all the area, or many of the area grocery stores and shopping centers, and those that have specific hours for seniors only. We have a link on avoiding coronavirus scams, which it has really, the scams have gotten ridiculous. The first time we talked about these links was back in March. Now there are even scams that have to do with getting tested. So you'll want to check that link out. Senior meals, with senior centers being closed during the pandemic. There are several agencies that have started delivering meals or providing meals to seniors that need them. And then, of course, Maryland and DC both have coronavirus information and updates. And again, that link will be in your email that we send you. All right, let's see if we have some questions.
Mariella, excuse me, this is Jules. I just also want to provide Montgomery County residents with a very valuable link. If you go to the Montgomery County government website, there will be an entire senior page, and you can also sign up for electronic e-newsletter for all benefits in Montgomery County, including transportation, meals, food, help with utilities. It's a fantastic website, and Montgomery County is a huge proponent of helping seniors. So I encourage everyone to visit the Montgomery County, Maryland.gov website and just click on the senior page, and there's tons of information there.
Yeah, so that's Mary Ellen, Maryland Gov.
It's www.montgomerycountymd.gov.
And we will certainly add that to the links that we provide you. Thanks, Jules.
Sure.
Okay, so I have a question for you, Jules. Someone asked, hi, I came in late, but wanted to know if I can apply for my 93-year-old father if I don't live in Montgomery County, but he does. I am 70 years old and I commute 60 miles to help him.
Wow.
Also, is this limited to low income, or can anyone apply?
Well, I'm sorry to hear that. That's a lot of traveling. Unfortunately, the primary caregiver must reside in the same resident with the senior. That is the main qualification. So you have to be the full-time live-in primary caregiver. For seniors, there's no income requirement at all. We do not ask for income, and you'll notice that on the application. Now, if you want to call me, I may be able to give you some other resources, but I encourage you again to go to the Montgomery County government website, and there's a lot of other resources there that may benefit you, depending on whether your father receives Medicare or Medicaid will determine the type of services that they receive.
That's awesome. And don't forget too, if he is a vet, let us know. And certainly there could be some additional benefits for
And
him.
Mary Ellen, I'd like to add that during our orientation, we found out a lot of this information about the family. And if they are a vet, it's easier to apply for our respite services while they're applying for the veteran services. And we work with most of the home health care agencies that have the veteran contract. So it's a smooth transition from our respite to military respite. So that's really important to know because it's just easier for the family to work with the same agency, and it's a smooth transition going from our respite to veterans respite.
Wonderful. Thank you. All right, another question. Pre-COVID, what social programs, I just lost it. Hold on, it blanked out. Hold on. Okay, pre-COVID, what social programs did you provide? Are any activities conducted via Zoom? So I'm assuming this is for you, Jules.
For me, well, we work with several social programs. One is in King Farm. They have, instead of an adult medical day, they'll go there and use their respite hours to participate in activities. And I'll be happy to get that name for you. Some seniors were taking classes through Montgomery County Recreation. And right now, as far as Zoom goes, so many of the therapeutic programs in Adult Medical Day and these programs are closed due to COVID-19. I have not known of any of the senior programs that are doing Zoom. I could certainly find that out for you. There is a organization that is in Bethesda called Oasis, and they provide a lot of educational classes that I'm sure you could do by Zoom.
Yeah, there's also the Benjamin Gaither Center in Gaithersburg. Get on their mailing list because they have Zoom classes from exercising to fishing. I've never seen anything like it, so it's wonderful. And of course, we have our coffee chats every other week. So be sure to be on my mailing list as well so you can keep up with that. Any others, Jules, that you can think of?
Well, we're working with all consortium members, but we're finding that a lot of the therapeutic programs are slowly opening up. We work with a lot of therapeutic programs that care for adults with disabilities, and they're starting to do one-to-one exercises in the backyard. There is an organization called Spirit Club. They will do personal training one-to-one in your home and by Zoom. So I would check that out, Spirit Club. The owner's name is Ciner. He's an amazing person. So if you're looking to do some exercises by Zoom, he may be a great contact, and I will be happy to provide that information.
That's terrific. You know, it's true. We do have another question, but before we go there, I just want to mention, you know, we're talking about respite and helping that non-paid caregiver have some time and have some me time, so to speak. But, you know, it's true, we're so limited on what we can do right now. And I worry about our seniors as well, who are just staying home day after day. So to be able to have some of these virtual activities can really be a lifesaver, literally. Okay, another question. My 82-year-old mother lives with me and my family. What exactly does the respite caregiver do with the frail senior? Do they provide a social visit? It is difficult to communicate with my mom as she has hearing and vision issues. Sorry, excuse me.
So the respite, we have 2 levels of care in respite. Level 1 meaning a non-skilled worker, caregiver, such as a CNA or a GNA, a certified nursing assistant or certified geriatric assistant, will come in the home and they'll assist with ADLs, activities of daily living. So if they need some bathing, toiletring, and
Help
some
with
life
meal prep.
and bathing, and it then also can be a social visit. They could read to the person, for example. We encourage our families to give our consortium members, like Visiting Angels, as much information as possible. When Visiting Angels would go out and do an assessment of the family, they're going to ask all these sort of questions, like, what does your loved one like to do? What do they do for socialization? What did they used to do in the past that maybe they can't do anymore? So, Mary Ellen, you could probably speak to what Visiting Angels
Yes.
does for people that have some difficulty communicating and hearing and vision issues.
Yes, absolutely. So, you know, it's interesting. We do a nurse assessment before the care begins. And that allows us, just as Jules said, to get a picture of what your loved one was like in their younger years, things that they like, things that get them excited, what your goals are as well for the care of your mom or your loved one. And all of this, along with all the medical information we need, is kind of packaged up into a care plan. And so you and the care coordinator at Visiting Angels will connect and make sure everyone is on board with the care plan. Now, if you have a loved one maybe has dementia, because that is the most often cited diagnosis for our clients is dementia, Alzheimer's, memory issues. So we have trained caregivers who know how to communicate effectively, how to use strategies with your loved ones so that they can communicate together and they can have a very engaged afternoon or session, whatever the case may be. As a matter of fact, we just held a training on dementia and COVID, and how COVID has really put a wrench into the daily care for a lot of dementia patients who are so set on their routines. And now for many of them, that routine has been curtailed because they're not really supposed to leave the house, so to speak. So yes, we do ongoing training. And again, it's a very collaborative effort between the client family, and the caregivers. So yeah. All right, let's see. Do we have, oh, I think that is it. So let's give it another second. Tiffany, are there any questions on the Facebook Live?
No, there isn't.
Okay, terrific. So let's give it one more second in case anyone else has any questions. Again, we will be sending out this recording and we will have all of those links for you. I will get the links that Jules mentioned for the Montgomery County page, as well as the fellow who does the Zoom exercising.
Yeah, I'll be happy to send his contact information.
Okay.
And I would encourage the family that has the senior living alone who's traveling to definitely check out the Montgomery County government website. And you feel free to call me as well, and I'll be happy to talk to you.
And let me just give you Jules's information one more time. And there it is. All right, so just to let you know, normally we do these calls every other week. Next week we're doing, we're kind of compressing the schedule due to vacation. So our next coffee chat is next Wednesday, the 19th, and it is our third in the series on Alzheimer's. And once again, I have the lovely Sheila Griffith joining me from the Alzheimer's Association. We're going to be talking about how to have discussions with your loved one who has memory issues. But for now, I want to thank you, Jules. This was so informative. And for those of you listening, maybe you don't need the respite services, but maybe you know someone who does, or you have a client who might be able to take advantage of this. Please, please, please spread the word, let them know. Jules, is there anything else you would like to add before we close?
No, just keep in mind that we are working remotely. We do our best to get back to families in the same day, but we are extremely busy. We have a lot of requests for new applications, and we will get to you. I think email is the preferred method for me, because I spend most of the day on the phone, but we eventually will get back to you. So I just want to thank you one more time for setting this up. I've really enjoyed it. And I hope this discussion about the coordination of respite through the Arc Montgomery County has been helpful to everyone. But I have to concur with you, Mary Ellen. I'm sure everyone has a neighbor or friend who is a caregiver taking care of a loved one with a disability or a frail senior, and they certainly can benefit from our program.
Absolutely agree. Couldn't agree more. Jules, we're going to have to invite you back this fall so we can continue this conversation.
I would love to, and I'd love to be invited to any future coffee chats. Every day we can learn something new that will be beneficial to the community.
Wonderful. All right, everybody, take care. Thank you again for joining us, and go have a wonderful day. Thank you.
Goodbye, everyone. Have a great day.
Bye-bye.